Welcome back, everyone. Let's face it, seasons are changing. It's getting cold out there, right? About to go into winter. What a lot of us don't really understand is how close a major portion of our population is to being homeless. Think about it. You could be one step away. You're a single mom, single dad. You have a job, it's minimum wage, your car breaks down, you can't get to work. The next thing you know, you're in trouble with your job. Immediately following that, you're in trouble with your landlord. Well, we've been chasing this topic a lot, as you probably know. And joining me today is John Farrell. I met John about 4 or 5 months ago when we were over at Open Door Mission in Glens Falls. And John works for the Warren Washington County Association, for Mental Health. So first, welcome, John.
Thank you.
Nice to have you here. I don't know your title. It's a long title. So I'm going to leave you to tell me what your title is.
At times it comes out hard on me, too.
What is it?
I'm the Assistant Director of Residential Program Operations and Development.
Well, now you know why I didn't try that one.
It's
John is an expert. He's been involved in this industry for 25 years, and in this title for the past 2 years. You know, it does really stun me, John, when you talk about affordable housing and how close a lot of people are, especially if they're bordering that poverty level, about how important it is for them to maintain a sense of living, sense of home, and how that contributes to their sense of purpose, right? When you talk about affordable housing, HUD has certain guidelines for that. What does that mean?
well, in the HUD rules, those folks in affordable housing, they're people who are only having to pay 30% of their adjusted gross income. That leaves enough money to pay for some of the the little things like gas, insurance, your kids' clothes, things we all take for granted sometimes if we're comfortably paid and living in maybe a 2-income household. There's a lot of people living on minimum wage, have a child, living alone, that is without the benefit of a second income. Those single parents they struggle. They may be just outside being eligible for the system, that is those assistances that some folks are able to access, and so they struggle, and that has a toll, weighs a toll on a lot of people.
Well, I'm sure it does. And then of course there's a stigma of mental health. In our particular society, I don't think that there's a real understanding of the scope of what that means, and hence you're stigmatized right away. Many of us could relate to it, right?
Well, oftentimes, I know that from my experience, there are people, especially young folks, who may just becoming aware of their mental illness and struggles as a young person, but are more keen on using substances to self-medicate versus getting assistance right away. A certain denial takes place, and of course that can lay the groundwork for some very negative experiences in their early life dealing with it. As I was saying to you earlier, sometimes, especially in today's society, it's almost sexier to say I'm an addict than I'm mentally ill.
Think about that.
So oftentimes you'll see a celebrity or a politician who goes to a rehab and can come out and say, I'm all better now. But if you say, I'm struggling with a mental illness, that's a lifelong struggle. So that's not exactly something people want to grapple with right away. And fortunately, once they do, a lot of good things can come of it. They can get the right help they need.
Well, that's where you step in.
Well, that's where the folks in my agency and I try to help those individuals.
How? How do you do this?
Well, oftentimes we get referrals from hospitals, people right off the street from families. Maybe they're aging out of their household with their mom and dad. It could be somebody who's in their 40s and their parents are just getting a little too old to take care of them. And maybe for the first time getting the kind of help they need outside of mom and dad and family. There's a whole variety of ways that they come to us.
All right, so they do come to you. What kind of services then? How do you do needs assessment? How do you then decide for all of the different services that you provide what might be the most appropriate?
Well, when it comes to a needs assessment, that we get feedback from therapists and clinicians. They make recommendations, but then from our expertise, we look at, try to meet the folks where they're at. Some don't want to go into a community residence and be 24-hour staffed. And sometimes we have to compromise with them. If we see the need, we might put them into an apartment program where staff reaches out to them on a daily basis to make sure that they're working on their goals and trying to get better suited or better ready to live on their own. We also meet people in the community with care managers, try to hook them up with some rental assistance where it's appropriate. Some folks need help with benefits that they never knew that they were eligible for, that can help make their life a little bit better.
You know, we hear that with veterans especially, that they're totally unaware of the programs that are available
You
to
don't
them.
know what you don't know.
Yeah, I know. All right, so when it comes to housing, from our conversations, you mentioned, you know, there's a sense of independent living, and then there's a supportive living, transitional living. So you're really trying to identify the needs and then try to fit it into a housing situation that is either independent, transitional, or supportive. Is that correct?
That sounds good. It sounds correct. Everybody has different needs, so we try to give them a bit of each piece off the menu so that they can get what they need.
Right, and with the ultimate goal, I would assume, of getting them stable and getting them to support themselves.
That's always our goal.
Yeah.
Either to maintain a certain level or to improve to that level. That's always our goal.
You know, I want to backtrack because I don't think I made this clear
Yes.
up front that November is Hunger and Homeless Awareness Month. And in the week of November 10th, you're doing a poverty simulation
Correct.
that a number of our community leaders, politicians and leaders in our community have been invited so they can understand firsthand a little bit more of what it's like.
Right. Our goal is not to lecture these folks.
Right.
I mean, they're all intelligent, educated individuals who are serving the community in whatever capacity they're serving it. Our goal is to try and give them a little bit more of a flavor of some of the challenges that someone who's faced with homelessness or teetering on homelessness goes through. And hopefully that will help guide them or help them make better decisions going down and how to help the very folks that they got elected to serve to help them in their struggles.
You know, I've talked to people over the years who have participated in these kinds of simulations or events. They're real eye openers. You know what I'm saying?
I do, and I've gotten some really good feedback. I know that just a few years ago, the teachers in one of their superintendent's days in South Glens Falls did something similar to this, what we're going to do. And many of those teachers, I heard feedback that they were just like a lot of aha moments out there, things that they just would be taking for granted. What do you mean you can't make it to the appointment? Just jump in your car and go.
Yeah, right.
People don't have cars. People
That's
don't
right.
have childcare right at their ready. They don't have the supports from family and friends and loved ones. Some are all alone out there, maybe for one reason or another. And it's very difficult. And once you get that experience, it's quite eye-opening.
It's really something, John. You know, we always encourage you to support organizations like this. You know, you can donate in whatever. But you were saying before, you know, right next door here, and I'm sure we're going to include a couple of shots of the housing units right next door, which are these traditional supportive housing units to help people. There's 18 units in this building. It's always full. Maybe one or two families a year, you were saying, will move out of this.
Well, they're not families. They're all singles in this
Singles,
particular.
okay.
Yes.
And but the whole idea is that we need to help. But people can also help by volunteering and doing things like that too, right?
Right. Many of our agencies that are associated with our continuum of care, they count on volunteers to help. I mean, just right now we're opening up in Saratoga and in Warren County our Code Blue Center. Shelters of Saratoga
sure.
runs
That's right.
one in Saratoga and Open Door here on Warren Street in Glens Falls. They're going to need volunteers to help at the facility or donations to help with the folks that they're trying to serve, whether it's food or clothes. I mean, I know sometimes we even have one of the agencies do like they look for socks because a lot of people who are on the street
I've heard that.
just need good, clean, warm socks to try and get through the day. It's amazing what that can do just to help someone's spirits to get those little small donations provided for them.
You know what I really want you to think about what John just said, a pair of socks, right? Sometimes it comes down to that, things that we take for granted. So look, it's that time of year, it's getting cold and whatever. I really encourage you to, check out Warren Washington Association for Mental Health, check out the Open Door Missions, Shelters of Saratoga. Really do try to take a look at what these organizations are doing and do what you can to help them help those people that really need.
I just also want to make a
Yeah,
plug.
sure.
For the 14th of this month. There's going to be open to the public a symposium being held. That's Wednesday the 14th at the Open Door Mission on Warren Street
In Glens Falls.
in Glens Falls. It's going to be from 6 to 9, I believe it's going to go till. But that's going to be a lecture discussion format where people can come and talk. So you don't have to be worried about having to take on a role or do any role playing. So please come out. I'm sorry, and see what you don't know. Learn a little bit, talk a little bit, see what you can do to help out.
Right, good, John. Thank you very much. Thanks for inviting us over.
Thank you.
See this interview again. You can head to our website, looktvonline.com.